when I had the opportunity to talk to families about what hospice services were all about, and we get into the conversation about how did they feel about their situation, and I would ask them, well, what are your goals? What do you hope for your family member, and what are you worried about? And they would talk about, that they wanted their loved one to be comfortable, to be pain-free, that they would like to. I would ask them to describe what a peaceful death looked to them, and I think their biggest challenge was feeling like going on hospice was like giving up. And so we would try to reframe that and talk about what our approach was, and sometimes depending upon the diagnosis and the symptoms that patients were struggling with, we could try to address that in a comforting way. If you could talk to people about how you would approach their symptoms, that was reassuring. And as you explained all the resources and how it would come to help a family, and they could understand that they had a choice in that. If they weren't ready for the social worker to come, we could put that off until they were. The biggest challenge is that people want what home health and hospice have to offer, but they don't know how to get it, and they don't know how it's reimbursed.
And I do think, you are correct, and it continues to be a problem to this day. We always say, I wish people would, hear about this more, sooner and get on service sooner. And hospice is a 6-month benefit. I think a misconception is people think when they hear hospice that, that means I'm gonna, I'm gonna die. But we are there to help support that patient and family, getting a patient on sooner, actually, hopefully being proactive and getting to know your team is really helping set that patient and family up so that they can be better prepared, and we can make sure we know their wants and their goals, and they can really drive that care.
One of the other components of hospice is the aftercare of the family, and going through a death and dying situation with a loved one in the home or in the hospice house is very taxing for the family, very emotional. And in the hospice program, you continue the care with the family. You don't just end it with the passing of their loved one. And it starts really prior to the patient passing, with social work and chaplaincy working very closely, routinely with the families, but then it continues after the loss of the loved one with the bereavement program.
It's good to get in there sooner so that we can help that family, but also there's lots of evidence out there that when you come on to hospice services, patients actually, because of the good care we give and because of the medications and the symptoms that we can control, patients live longer. And so, it's just not well known that, but people do live longer on hospice, and they have, better symptom control. And like Dodie said, that's, everybody says, why didn't I ask for this sooner? I just didn't know what I didn't know. And so
we are challenged in healthcare to guide our patients and families to talk about what they want. It's a subject that's difficult, one that feels legal to a lot of patients and families, where indeed it's not legal. It's about what you want in life. And throughout your life, what your wants are different. Or when you develop a disease that you had not ever foreseen. So I encourage all of us to talk to our families. Tell them what means the most. Have that discussion with your physicians so that they know what means the most to you, and know that it changes throughout your life, and be open.
Yeah. I think another thing that people don't realize is you can change your mind. You know, coming on to hospice services is, it is a big step, and it's scary, and your team's there to help you, but hospice is all about the patient and family, and they drive that care, and that's the beauty about hospice is it's all what's important to them and what their family wants and what makes them feel comfortable, and so. It's the kind of care that we, is really driven by patients and families, and what we all want to provide, because that's how it should be.
And they don't have to do it alone.
Exactly.